So good afternoon. Yes, I'm Alain Favina, and I'm about to present to you some results from a study we conducted in Rwanda. I think they are interesting. And we conducted this study in this year. I will mainly... Good. This is the outline. I will give you some background about this study, but also I will give you some information about the method that we used, then the results, and a small conclusion and some implication in advocacy. Since the HDI, the NGO where I work, is focusing on advocacy in the community, mainly surrounding community health. So for this presentation, I'm going to talk about mainly domestic workers. As you saw, it was the study population. But I'm going also to talk about three main variables. One is resilience, another one is post-traumatic stress disorder, and the last one is suicide ideation. Maybe we know that domestic workers face a lot of challenges in their environment, in their work environment, and according to some results, some researchers, they face sexual harassment more than other workers, and some figures were around 64% or 74% of people having the prevalence of sexual harassment. This gives a picture of some kind of power dynamics that we found in this work, specifically for domestic workers, where the employee live in the same setting with the employer. And we have been seeing many cases of sexual abuse, of physical abuse, but also some cases where people report financial abuse. Because of the poor legal framework, people are working without contract. And it was developed, I think, highlighted from some previous studies, which we did not conduct, but some other people conducted in Rwanda, that show that many people, like many domestic workers, are facing different challenges. Because of that, yes, of course, they are stressed, they are psychological distress, and because of that, many studies, again, have been showing high prevalences of mental issues. They can be PTSD, depression, anxiety disorders, suicidal ideation. It was not part of this presentation, but to give you a picture, in this study, we found that the PTSD was at 23.5%. The suicidal ideation was at 32.5%, which is extremely high. Then there we just ask ourselves if there may not be something that can help them. And in this case, it was resilience. And as the definition we see here, it's about that process, that capacity to successfully have a nice adaptation to a challenging situation. Okay? Then we went ahead and see if there is maybe any person that did more than finding relationship between these variables, to look for the role of this resilience between PTSD, and we found it wasn't. It was mainly underexplored. So, from that point of view, we had these objectives for this analysis, and it was to investigate again the relationship between the PTSD, the resilience, and suicidal ideation among this population, but also to find out, to elucidate the mediating role of resilience. Can it do something at the end between PTSD symptoms and suicidal ideation? Following the guideline of mediation or analysis, there are some hypotheses that need to be checked. And the first one is about the relationship between PTSD and suicidal ideation. And after that, there is a second hypothesis, which is the relationship between PTSD and resilience. And as you see, the first one is about a positive association. Is the increment in one also increase the likelihood of the other one? The second one and the third one are negative association, where resilience is supposed to be negatively associated with either suicidal ideation or PTSD. And let's figure it down, trying to find out what we tried to analyze in this study. And I think I will come back to this figure later. So the method we used, this was a cross-sectional study. We conducted it in Kigali, Rwanda. We involved 884 domestic workers. The enrollment procedures, we got help from community health workers who are in the community and knows where these people are living, and they were recruited from the nearby facility. So the ethical consideration, we got ethical approval from the Rwanda National Ethics Committee, and people who were enrolled in this study provided informed written consent. For assessing the tools the three variables that I talked about at the beginning of this presentation, we used tools, and for the resilience, we used the resilience scale for adults, and for PTSD, we used the PTSD checklist for DSM-5, and suicidal ideation, we used the general health questionnaire, the GHQ-28, and the mediation analysis were done following the Baron and Kenny approach using the SOBO test. And as I said earlier, the reporting of the result followed these guidelines. So the results, I think remember this figure. We found that the three hypotheses, we couldn't, the p-values were below 0.5. And actually, as we stated before, both association between PTSD and resilience and suicidal ideation and resilience were negative. So this showed us that the resilience was found to play a role as a partial mediator between the PTSD and suicidal ideation in reducing suicidal ideation among domestic workers. So which conclusion? So this underscored the importance of resilience in mitigating the impact of PTSD on suicidal ideation among domestic workers, and intervention aimed at enhancing resilience may prove beneficial to reduce specific risk in this population. In more detail, because as I said earlier, this HDI works in advocacy, we think to call upon a collaboration between NGOs and governmental organizations, as we have been doing, but this time to put together people who have been working in mental health, labor rights, for advocating for mental health of domestic workers, but also for a better legal framework for domestic workers, and because this will pass through lobbying for policies that improve the safe working conditions and improve the mental health of domestic workers. But also we think about raising the awareness of mental health and the importance of resilience for individuals with PTSD and suicidal ideation through advocating for better access to mental health services for domestic workers, because maybe I may not present this, but we found the majority of them do not have insurance. And we will find a way of advocating for training for health care providers to teach resilience building skills. And this is the end. Thank you very much.